There are a number of treatment options for patients with relapsed and refractory NHL, and they're not great, and we need to make further progress. Part of it depends on what you got for your frontline therapy. For example, if you've got R-CHOP, then bendamustine is a reasonable alternative. We don't have much in the way of data on the reverse, however. There are a couple of drugs approved in the United States in this setting. Zevalin or Y90 ibrutinib tioxetine, which is radioimmunotherapy but is rarely, if ever, used anymore, and idelalisib or Zidelig, which is a PI3 kinase inhibitor. It's pills, but there are some untoward effects that have been fairly bothersome. So there really is a need in this space for better therapies. And one that has just been approved by the FDA is the combination of bendamustine and obinutuzumab. The rationale for using bendamustine and obinutuzumab is one, bendamustine is one of the most effective single agents for the treatment of follicular and low-grade lymphoma. And two, obinutuzumab differs from rituximab in that it has greater ADCC and direct cell killing. And in vitro models, bendamustine and obinutuzumab was more potent than bendamustine and rituximab. There were a number of important efficacy outcomes in the GADOLIN study. Although the response rates were comparable between the two arms, there was a longer progression-free survival, time to next treatment, and most importantly, there was a significant reduction in death, a longer survival in the combination arm, despite the fact that there was a lower dose of bendamustine in the combination arm of 90 milligrams per meter squared versus 120. So despite the fact you're giving less chemotherapy, the antibody resulted in better outcome for patients with follicular lymphoma as a subset and indolent lymphomas at large. The main safety findings in the study were that the addition of obinutuzumab to the bendamustine, in fact, wasn't associated with much more toxicity, except the infusion reactions associated with the antibody infusion. There was a bit more neutropenia, but without a major increase in infections or neutropenic fevers. In contrast, the bendamustine alone, which was a higher dose than in the combination, was associated with more thrombocytopenia, more infections, and some other findings. The incidence of secondary malignancies and all sorts of things were comparable between the two arms.